Hello, everyone. My name is Dan Schoenfeld. I'm Vice President of ASCM. I'm in charge of the foundation, our 501c3 philanthropic entity, and I'm going to be your host for today's webinar. We're going to talk today about our Global Health Supply Chain Maturity Model. I'm joined by Glenda Mayton, our Program Director for our Global Health Supply Chain Initiative at ASCM, Balaji Olawoden, and Eric Bukaria. Both are our ASCM Public Health Initiative Country Directors. Balaji's in Nigeria and Eric is in Kenya. The ASCM Foundation Global Health Supply Chain Initiative in Africa is our long-term strategy we began in January of 2019. Supply chains are truly shaping the world we live in, with economic, environmental, social, and ethical stakes for every person and place on Earth. This is only being magnified as we deal with our current challenges around the global COVID-19 pandemic. As supply chains become more technologically advanced, complicated, interconnected, and global, these stakes only grow. Here at ASCM and the ASCM Foundation, we see extraordinary mission potential at this moment. We can mobilize global supply chain communities, extraordinary leaders, and visionary partners. We can also bring prosperity and opportunity to more people and places and solve critical problems that affect countless lives. Our current investments include the Bill and Melinda Gates Foundation grant, a technical support services agreement with the Global Fund, and an ongoing relationship with the United Nations, USAID, and others. In today's webinar, we will go through one part of our initiative with the Bill and Melinda Gates Foundation. Specifically, that included our digital maturity model. This digital maturity model was built to increase the technical capability of ministries of health in Africa. Glenda, Balaji, and Eric are on the ground in South Africa, Kenya, Nigeria, and Senegal, and have done an amazing job not only leveraging the voice of the customer in Africa, but affecting real change on the last mile delivery of essential medicine in these countries. It is now my pleasure to present Glenda, Balaji, and Eric, who will talk more about this exciting tool in our ASCM Global Health Supply Chain Initiative. Balaji, I'll turn this over to you.
Thank you, Dan. Thank you so much. For ASCM members joining us today, I'm sure you'll be curious, what is the overall goal for ASCM? What are we doing in public health? What are we doing in global health supply chain? Today, I'm going to be sharing with you 4 key interventions ASCM is doing in the global health supply chain space. The first intervention is building sustainable supply chain communities in these target countries. We are working currently in Nigeria, Senegal, and Kenya. How are we doing this? We are dramatically scaling up the use and the impact of global health supply chain maturity model. We will actually take you through this tool today for you to understand what are the capabilities, what you can do with this tool. Secondly, we are focusing growth in supply chain communities. This we are doing locally at the country level, regionally across Africa, and also globally. We are leveraging the membership strength of ASCM. We're also focusing, using our approach to leverage on our proven best practices to grow as an effective, sustainable supply chain association in these countries. The third intervention is the increase in the utilization of the global health supply chain maturity model. This tool can be used 2 ways. One of the ways is a self-assessment. The other way, which we promote with the Ministries of Health in the countries we work, is through facilitated assessment. Some of these interventions that we've done in the past, my colleague here, Eric, will show us as we go on. Lastly, we are focusing strategic capabilities within Ministry of Health by mentoring and transfer of knowledge to staff in these countries through our formal certifications that you know, CSCP, CPIM, CLTD, SCORP, to ensure transfer of knowledge within these countries. At the end of the day, what are we looking for? We expect, and what we found, is that we have increased in technical capabilities across these countries. Furthermore, we are seeing increase in country capacity of local supply chain leadership in the focus countries. We are also seeing decreasing knowledge gap between commercial and public health supply chains. At the end, our ultimate impact, we feel, like Dan mentioned earlier, is improving last mile product availability and access to medicines in this country. ASCM has three key pillars: our corporate transformation pillar, our learning development pillar, and our making an impact pillar. Our ASCM Global Health Supply Chain Program falls under our making an impact pillar, which is linked to our ASCM Foundation. In the US, we have our executive sponsor as our Chief Executive Officer, Abe Eshkenazi, and our program sponsor as our Vice President, Dan. The way we work within the team is use of our expertise within the ASCM network. We have regional offices and program office in US, Brazil, and South Africa. So you are curious, who are the members of the GHSC team? Who is the Global Health Supply Chain Technical Team? One thing ASCM has done in the past 24 months is to use our voice of the customer approach to problem solving. This ensured that the team on the ground, other stakeholders in the global health supply chain space welcomed us. This team comprises of highly technical professionals. And one key thing we found out that really makes an impact is listening to the customers, our patients, the governments in these countries, and other stakeholders within the global health space. The team is led by Glenda Mayton, the program director, she is based in Johannesburg, South Africa. In each country, the focus country, we have two directors each, myself and Bolu Awesu in Nigeria, Eric and Judith in Kenya, and Dr. Mamadou and Clomo in Senegal. Lastly, the team is mentored and coached by Peter Bostoff. Peter Bostoff is the Executive Vice President of our Corporate Development. Peter oversees the ASCM Corporate Transformation Value Proposition that includes our supply chain talent development and corporate supply chain performance in ASCM. Peter is also the respected author of our Supply Chain Excellence book that uses SCORE model as an improvement model. Finally, our team works with mutual respect. We work as a team across Africa. We have 6 directors in 3 countries. However, each director provides support to other countries beyond their respective base country. I will then move on to Eric, who will actually provide more information about the Global Health Supply Chain Maturity Model tool.
Thank you, Dan and Baraj, for that good introduction. Now we want to do a deep dive in the Global Health Supply Chain Maturity Model, but before that, let's look at some perspective of the public health supply chain. Now, when you talk about the public health supply chain, we know that the ultimate goal is to improve the health and well-being of people, and this is achieved through the increased access to quality and affordable health commodities. The other critical aspect of the public health supply chain is that the supply chain needs to be adaptable and flexible, more so because of the changing disease pattern. We know, for example, the emergence of COVID-19, and not just the changing disease pattern, but there is also emerging technologies that are being used in terms of testing and diagnosis. For us to meet these needs, then that public health supply chain needs to quickly adapt and be flexible. The other critical aspect of the public health supply chain is that many players come into the space to ensure that we are providing access and quality health commodities. And this includes the government, it includes the public sector, faith-based organization, and other people that are interested in that space. So for that to be enhanced, great coordination is of importance. Now, having looked at the public health supply chain, let us look at why do we need to assess our public health supply chain. One of the critical aspects that we need to consider when you're assessing our supply chain is to be able to provide evidence-based investment. This is important because we know that resources are scarce and therefore we need to get value for money. The other thing is that we need to monitor the performance of our public health supply chain. And we monitor this by identifying what are the gaps and coming up with the corrective actions that can help us close these gaps. And when those corrective actions are implemented, then there is continuous improvement of the public health supply chain to meet the ultimate goal, which is provide access and quality health services. For us to assess our public health supply chain, it therefore means that we need a very robust assessment tool. And this is where the global health supply chain maturity model comes into play. Now let's look at the global health supply chain maturity model. The distinction of this maturity model with other maturity models that exist out there, first is that it's a self-assessment tool. And being a self-assessment tool, it means it can be rapidly implemented to assess the supply chain. The other distinction is that this tool is a multi-level assessment tool. It can help in terms of assessing an individual supply chain, let's say, for example, family planning, HIV or malaria. It can also be used at a county level or at a regional level. It can also be used at a national level, for example, if you want to assess a national supply chain. And therefore, it helps in terms of assessing multiple levels of the supply chain. This tool, the Global Health Supply Chain Maturity Model, is based on the theory of constraint, and therefore it helps in terms of identifying what are the constraints that are preventing the public health supply chain from maximum performance, and not just identifying, but making the constraints visible, and therefore resources are directed to address these constraints. The other critical aspect of the Global Health Supply Chain Maturity Model is that it does the assessment of the end-to-end supply chain, looking at issues of strategic importance, tactical issues, as well as operational levels. And therefore, you get a comprehensive view of the maturity level of your supply chain. And lastly, the global health supply chain makes an assumption that as maturity increases, the products are available to the end users, and therefore also the supply chain performance increases. And at the end of your assessment, then you're able to grade the supply chain either at a canvas level, bronze level, silver level, gold level, and the most mature level being the accredited level. Now, having looked at the basis of the global health supply chain, it has been a journey to where we are in terms of this assessment profile. And this has been possible by leveraging on the voice of the customer, the past success, as well as industry-based practices. When we started with the global health supply chain, it was an Excel-based platform. But there has been a lot of iterations and improvement to now what we have as a cloud-based survey instrument. And this is made possible by data engines that are able to transform the data that we get to user-friendly dashboards that can be accessed on our website. And not just the tool that has been improved, but also the assessment profile. We have been able to institute measures where we are training facilitators. We are able to make sure that they have the knowledge, the skills, and the competency that is required to offer credible assessment. So improving both the process as well as the tool. And with that improvement, we are able to offer a tool that is more user-friendly and is also scalable at a greater magnitude. Now, through this journey, it's not just the improvement of the tool and the process, but we have also been able to incorporate quality, continuous quality improvement approaches to be able to conduct root cause analysis and therefore offer effective corrective actions for the gaps that have been identified. And this has been together with collaboration of the Ministry of Health and other players so that our solutions are tangible and they are addressing existing needs in the public health supply chain. Now, having looked at that, as we said that the global health supply chain is a comprehensive tool that looks at end-to-end of your supply chain. And for it to be able to do this, it has 20 categories that it focuses on. And these 20 categories looks at strategic issues, tactical issues, as well as operational issues. Issues to do with data visibility, issues to do with warehousing, issues to do with infrastructure, procurement, governance, issues to do with staff competency, and so forth. And these categories can be mapped to the score model so that it's able to translate to what exists as the best in class model that exists out there. Now, the other bit, if we go to the next slide, is once an assessment is conducted, of critical importance is how those results are presented so that they can inform decisions. And to enhance this is that we have been working with AppMetrics to have a data engine, robust data transformation engine that transforms the data into user-friendly dashboard that can present the result first in a simple way, but also these results of the dashboards can be customized for effective decision making. So when you look at the platform, you're able to see the immediate output of your assessment, but also you can be able to do comparability when you do a reassessment and also compare various regions. The reason why this is important is that it helps when you're doing root cause analysis, as you can go as granular as possible, and therefore you're able to identify the particular root cause why your supply chain is not maturing, and you can therefore implement effective corrective actions. Having said that, we have been able to improve the global health supply chain maturity model, and of recent we have been able to launch what we call a microsite. And this microsite is a one-stop shop where you get information about the tool. You can log into this portal and you're able to do an assessment. In the same portal, you're able to see the results of your assessment, but also you're able to be provided with resource tools that can help you as you implement the corrective actions. So it's very comprehensive, and it helps in terms of making the process efficient, and also helps in terms of scalability, because anybody seated at their place can access their supply chain from this portal. So this microsite is going to be a game changer as we move forward to improve the global health supply chain maturity model. Now, having talked about this, now let us go through this microsite and see some of the benefit that it presents to the users of the global health supply chain maturity model. So what I'm going to do now is to go to the microsite and demonstrate to you the tool itself, and I'm also going to demonstrate to you the assessment output that you get after you conduct the assessment. So as you can see, this is the microsite, and the microsite on the home page, you get to learn about ASCM, you get to learn about the maturity model, some background information. You also get resource materials. That is the playbook that contains some of the accompanying materials to help you in terms of the assessment. You get a toolbox which has a lot of materials that can help you to improve your supply chain, but you also get to visualize the results once you conduct the assessment. Now, the other thing that you get, as we said, is you get to learn what is the maturity model. You get to have a demonstration site if you have not interacted with the maturity model before, so you can go through the categories before you conduct an actual assessment. Now let us look at how you conduct the assessment and how you answer the questions for the 20 categories that we talked about. So the first thing, once you want to start an assessment, is to look at the assessment profile. Now, the assessment profile helps you to identify or to input key identifiers for your assessment. So you are able to specify the country where you are conducting the assessment. You're able to go down to the region if you are conducting this at a regional level, and you can even go granular where you're able to even identify the site where you are conducting the assessment. Having done that, you're also able, for example, to input the date of completion. So you put the month when you're conducting the assessment, you put the actual date, let's say for example to this date, and the year. And the other thing is you're able to specify the team that is conducting the assessment. The importance of this is it becomes a reference point if you want to circle back and ask for clarification from the team that is conducting the assessment. You are also able to select if the assessment is for a private facility, for a public facility, or for a non-governmental organization. Then the other thing is you're able to select if there is support for your assessment. Is it being supported by a specific donor, maybe Bill and Melinda Gates Foundation or any other donor that is supporting the assessment? And if no, then you select no. Then the registration code, as ASCM, we give you a registration code. This becomes the unique identifier of your assessment and helps in terms of filtering the results. And the last two bits is you're able to select the supply chain that you're assessing. Is it family planning? Is it essential medicine? Is it HIV? Is it malaria? Is it TB? And you can also do an assessment of an integrated supply chain. Say, for example, you combine HIV and malaria and they are all one supply chain. So that becomes an integrated supply chain and you can specify that. And the last bit, you also select the stakeholders who are present in the assessment and also select how many assessment has been conducted before. Is it the first assessment? Is it the second assessment? Or is it the third assessment? And finally, you're able to specify what is the source of information as you conduct the assessment. Is it first-hand information, meaning you need to have the right people in the room? Once you complete the assessment profile, now you go to answering the question for each of the 20 categories. And this is how briefly how the question looks like. So you have your questions here. If I can just click on next. So we have the 20 categories. The first thing is the category is specified. For example, here we have the service delivery point or health facility visibility. There's a short explanation on what the category is all about. There's even an objective so that at the back of your mind, you know why are you assessing this category? Then for each category, there are a set of questions that have been provided that you need your team that is conducting the assessment to respond to. And the answer they select is a consensus answer that signifies the as-is state of the supply chain. For example, in terms of service delivery point, one of the questions is, please describe the visibility of inventory and consumption data from the facilities. So you want to see, are you able to visualize data at the service delivery point of the inventory and consumption? And they have a set of answers they need to select to. Maybe it could be limited visibility, it could be some visibility, it could be a real-time visibility. So once they discuss, then they select the most probable answer that represent that state in terms of that question. So they do this for all the questions for that category. And once they're done, the other bit that is of importance is that there could be some constraint that prevent the improvement of that category. So they are also able to select a constraint. Is it human resource? Is it technology? Is it guidelines? Is it infrastructure? Is it government support? And this is critical because that constraint prevents the supply chain from moving from a certain level to the next level. So once they do answer the questions, there are about 70 questions for all the 20 categories, then they submit their result. And at the back end, the data engine now transforms those figures into dashboards that can be visualized and present the correct assessment and the correct maturity of the supply chain. Now let us look at how the assessment output is visualized. What do you get after the assessment? So through App Metrics, you're able to get multiple outputs that are represented by different dashboards. One of the dashboards is you're able to get the current performance. So you have completed the assessment. You now want to see, at what level of maturity is my supply chain. So first, you get the overall performance. For example, for this imaginary supply chain, they're at 49.6%. And that means they're at bronze level. So at a glance, you're able to see, my supply chain is at bronze level and my score is at 49.6%. So if that was your assessment 0 or assessment 1, then you have a baseline, you know where to start. And not just that, if you scroll down, you are able to see the performance per category for all your 20 categories. So for each of the categories, you are able to see, are you at canvas level? Are you at bronze level? Are you at a certified silver level, gold level, or accredited level? And it also gives you the performance score, percentage score for each of the categories. The beauty with this visualization is that you're able to compare your 20 categories and identify which ones are you struggling with, and therefore those becomes your weak links. You're able to identify which ones are you doing quite well in. So that way you're able to know, I need to address my weak links so that the overall performance of my supply chain can improve. So the other bit is we even go granular. For each of the categories, you get the overall score for that category, but you also get the performance per question. Remember the questions that were there in each category? So you are able to see out of maybe the 4 or the 6 questions, which of the questions am I struggling in? So that you know when you're doing your improvement, those are the questions to focus on. That's one of the dashboard. Let's look at another dashboard that you get. The other dashboard is the data engine helps in terms of comparability of all the assessments that have been performed. Maybe you have 20 sites. You want to see how have my sites been performing. So it gives you an aggregate performance for all the assessments. For example, here we have about 223 responses, and it breaks down that performance per version of the tool that was used. Version 6 we have 152, version 7 we have 60, version 8 you have 11 assessments. And also it gives you the aggregate performance for each and every of the categories. So you're able to see for all my supply chains, I'm struggling with, let's say, for example, with expiry management, or I'm struggling with staff development. The importance of this dashboard is you are able to identify cross-cutting issues that are affecting all your supply chain, and therefore you need helps you to identify what are systematic issues that needs to be addressed across your supply chain. And also, it gives you a breakdown of what type of organization was assessed, what type of stakeholders were there, what type of commodities were accessed, and this data is what was picked from the assessment profile. So this is, from a global perspective or from a macro perspective, you're able to see where do you channel the resources to improve your supply chain. Now let's look at another dashboard. This dashboard, it gives you assessment over time. It says, for example, you have done 3 assessments. You want to see, has there been continuous improvement? Or are you stagnating? Or is the performance deteriorating depending on the number of assessments that have been conducted? So on the right, you are able to see, since you started the assessment, how has been your performance? Have you been improving over time? For example, if you look at this imaginary assessment, in May 2018, the performance was 38.4%. In August, it was 48.9%. In November, it was 57.9%. So you can see there is continuous improvement, and that can imply that the corrective actions that these people have been implementing are effective. If there is a dip in performance, then you also query the corrective actions that have been implemented. So the beauty of this dashboard is you're able to track performance over time, and that helps in terms of also tracking the maturity of your supply chain. And not just the overall score, you are even able to track the performance of each of the categories. each of the 20 categories. For example, if you look at facility level inventory management, you can be able to track how the progress is. And this helps in terms of saying, my overall performance may be improving, but for certain categories, maybe they have not been improving. Now let's look at the last dashboard. The last dashboard it helps you in terms of comparability of different regions. Let's say you have sites in Africa, in Asia, and in Europe, and they are the same supply chain, and you have conducted the same assessment. So you're able to compare how is the performance across geographies. And this comparison is important because you're able to say, first, a certain geography is doing better than the other, and some are struggling. And therefore, if you have limited resources, you know where to direct those resources. So that's another dashboard that is very critical. And from another angle, it also helps in terms of healthy competition. If one supply chain is doing better than the other, then they're able to see how can we pull up our socks to be like this other supply chain. Now, having looked at the dashboards, let's look at another critical aspect of this data output or the assessment output. So once the team is able to see their result, they're able to identify their weak links, the platform helps them in terms of setting goals, because they have now their baseline performance, but they have their aspirations, which is their target. So they can log into the platform and set these goals here. Now, these goals can be set at the strategy level. For example, if you have multiple sites, you may have one goal, let's say, to increase the performance of our site from maybe canvas level to gold level. So that's a strategic goal. Or you can even set this goal at an operational level. Maybe you have conducted an assessment at a site level for a specific supply chain, and the baseline was 40%. So you can set a goal and say, we want to increase this site maturity from 40% to 60% by December 2020. And what happens is that you can update these goals every time an assessment is conducted. And this updating can either be manual, so you log into the system and update, or it could be automatic, where you have set the platform in the sense that once the assessment output is calculated, then the indicator updates automatically, and therefore you are able to track progress over time. Now, digitization of goal setting is important because even if you lose the manual tools, you have a reference point on the platform where you can come and review your results. The last bit that I want to talk about in terms of the microsite is the ability of this site to augment the quantitative data with qualitative data, in the sense that you are able to log into the system and create stories that can help you explain your quantitative results. So you're able to come and say, the reason why we are not improving maybe because we have not implemented corrective action 1, 2, and 3. So you're able to say, to augment that quantitative results. And these stories are important because anybody now interpreting the results is able at a snapshot to see this is the reason why this supply chain is performing the way it is. So this is a very powerful tool that is missing in most of the visualization platform. So those are the elements that you get from the digital health supply chain platform. So in terms of user-friendly dashboards, in terms of goals that are able to be updated, and in terms of augmenting your quantitative data with qualitative data. So I hope you have been able to follow with me and you have seen the benefit that you can accrue from using the global health supply chain maturity model. So let's look at now, go back to the presentation and look at what has been the impact of using the global health supply chain maturity model. So having looked at the tool and having looked at what it can offer, what have we been able to achieve so far since we started using this platform? One is that the assessment has helped to determine the current state of maturity and where we need to advance next. And not just in Kenya, Senegal, and Nigeria, there's been about 228 assessments. So at a snapshot, people are able to see what's the current state and where they need to advance. And also the other beauty is that we have been able to assess a distinct supply chain. We have actually used the Global Health Supply Chain Maturity Model to assess countries' preparedness to COVID-19 response. So that's a very critical use of the tool that has been necessitated by the current prevailing situation. We have also used this tool to inform the Ministry of Health on the strategic and policy directions that needs to be taken depending on what are the cross-cutting issues that we are seeing after the assessment. And we have also used this tool to build business cases for investors who would want to come and support the public health supply chain. So they are directed to certain areas that we have found weakness. So those are some of the benefits that we have accrued from this. And we are hopeful as we continue using the tool, we are going to accrue more benefit. And you as listeners, you can also log into the microsite and see how best can you also use the tool.
Great. Well, thank you so much, Balaji, Eric, and Glenda, for a great discussion and introducing our digital maturity model that we're using in our Global Health Supply Chain Initiative. And thanks for the amazing work you're doing on the ground every day to help improve access to essential medicines for the people of Africa. Our hopes in putting together this webinar is that others can leverage this free open source tool in order to improve the maturity of supply chains. As Eric said, it's a free microsite. And we need to thank the Bill and Melinda Gates Foundation for providing the grant that enabled us to work with the local ministries of health to build this model. If there are any follow-up questions or comments, please feel free to email me or anyone on the team directly. Also, again, please go and learn all about the tool. The web address is ascm/ghsc.org. Glenda, Balaji, Eric, thank you again so much for taking the time to be here and sharing your great insight. Now, I want to go into a few different questions that we've received ahead of time from the audience. Eric, what digital capabilities are providing the greatest value right now?
Thank you for that question. I think that I have three responses to that. One is the use of the data transformation engine, that is AppMetrics, and the robustness of this transformation engine has helped us to analyze results and also allow comparability of different supply chains. So you're able to compare different supply chains. Number two is that the transformation of that data and visualization has provided us with a platform where we have user-friendly, customizable dashboards. So the dashboards can be customized to the user request, and also allows in terms of granular visualization of the performance. And this helps in terms of conducting effective root cause analysis. And lastly, having a web-based platform has helped in terms of increase the efficiency in assessment and also in terms of scalability of use of the digital health supply chain.
Great. So the next question is one that we've received a lot lately. So Balaji, what are the main challenges with supply chain right now during the COVID-19 pandemic?
Thank you, Dan. I want to relate that to the public health space so that it gives some sort of perspective. Yes, I think the key challenges from Nigeria as an example as regards health and health products can be, maybe I should just give like 4 to 5 challenges. The first one is due to the lockdowns, national lockdowns we have in country and closure of airspace. What we quickly notice is that the APIs that we use as the active pharmaceutical ingredients for our essential medicines are from China. China has locked down the production facilities, meaning that we have low supply of these active pharmaceutical ingredients. Clearly, what that means is that we have low supply of essential medicine in country. Similarly, for India also, India provides finished goods, finished products, finished pharmaceutical products for a country like Nigeria. We import close to 40% of our needs from India. So obviously, due to policies from each country, everyone trying to support their own country first, we see some sort of policy restricting exportation of health products. So clearly, that's a key challenge for the supply chain in Nigeria. The third point is due to custom delays. In country, we had national lockdowns. What that means is that we have people working in lower capacity. We have customs working shifts. So what that means that you have so much cargo at the ports waiting to be cleared. And for pharmaceutical industry, this is a very critical step because you have more than 60 to 70% of essential medicine imported. So clearly, it means that you want to clear your goods as soon as you can, and this could not be done due to lower workload for the staff available. You have social distancing protocols, and all this cumulated in having also low supplies of medicine in country. One important aspect is that we started seeing focus shifting to the PPEs, that's personal protective equipment. What that means automatically is for supply chains that are struggling to even manage the health essential medicines, shifting priority to PPEs automatically also reduced the impetus and the focus on health supplies, which is also giving us some sort of drawback at the end of the day, where we have good health facilities, the patients are not able to access their medicine. Lastly, this is closely related to health products. Due to the poor communication between the government and the populace, we started seeing low clinic attendance rates. So people on medicines, people on essential medicines, especially the ones that are on diabetic patients, hypertensive patients, could not refill their essential medicines because they stopped going to the clinic. And this is a supply chain issue as far as we're concerned. So for the products that are available at the health facility, there is no uptake. And for the products that are not available at all, then the supply chain is broken. So we can go on and to talk about how the challenges we've faced, but these are some of the key challenges that actually the health supply chain is facing due to COVID-19.
Thank you. And then the final questions for Eric. Is this maturity model aligned to the business continuity plans of any of these countries that we're working right now?
Thank you, Dan. Yeah, this maturity, global health supply chain maturity model is aligned to business continuity, because we know business continuity is very critical, particularly with the disruptions that are happening right now. And one of the reasons why it's aligned is because this tool looks at the end-to-end of the supply chain, and therefore it focuses on removing constraints that would prevent the business from continuing. And once those constraints are removed, then the performance of the supply chain is improved, and therefore there is continuity in terms of offering services. The reason is that some of the categories that have been put in the global health supply chain maturity model focuses and are critical in terms of business continuity. Issues to do with performance management of your supply chain, issues to do with the analysis and evaluation. And therefore, once you assess these categories and identify what are the gaps and implement actions that would close those gaps, then there is the element of continuity. And the last bit is that you don't just do the assessment once. In case there are disruptions, then you can do reassessment, and it is hoped that once you reassess and implement actions, then there will be progress in terms of offering services, translating therefore to business continuity.
Great. Well, thank you again, and thank you, Balaji, Eric, and Glenda, for taking the time to be here and sharing all of this amazing insight. This concludes today's webinar, so thank you for participating. All content and materials included in this ASCM online event are the property of ASCM and are protected by the United States and international copyright laws. All rights are reserved.